You wake up, and before you've even checked the clock, your tongue is stuck to the roof of your mouth and there isn't a drop of moisture to swallow. Dry as paper. Maybe you keep a glass of water on the nightstand now, just so you can speak in the morning. And somewhere along the line, somebody told you this is simply part of getting older. Sip some water, don't make a fuss. And water does help for a moment. It does. But it wears off before you've even reached the kitchen. And the reason it wears off is the whole point of what I'm about to tell you. I'm Dr. John Myers, internal medicine, 15 years of practice. And I'll say this as plainly as I can. That dry mouth is a message. Every morning, your body is telling you something. And for most people past 60, it is telling you one of two things. Either something you swallow every single day has quietly switched your saliva off, or a condition nobody has caught yet is showing itself through the one fluid almost no one ever thinks about. Saliva does far more than keep your mouth wet. While you sleep, it does 4 separate jobs that keep you safe. And when your mouth dries out, all 4 of those jobs stop at the same time. Each one that fails opens a different door. One toward your lungs, one toward how well your food actually feeds you, one that runs straight into your bloodstream and your heart, and one you will feel first in your teeth. And before you click away because you are sure a dry mouth is a small thing, hear me out. In a large study published in Scientific Reports in 2021, older adults with dry mouth had a measurably higher risk of dying in the years that followed than those without it. Now, a study like that cannot prove the dry mouth caused anything, but it is picking up on something real. Dry mouth tends to travel with everything I am about to show you, all of it stacking up in the background while people keep calling the dry mouth nothing. By the end of this, you will be able to read your own dry mouth the way I do, what each version of it is warning you about, which of your own medications is the likeliest culprit, the exact words to say to your doctor so it finally gets taken seriously, and what genuinely brings your saliva back, because it is almost never another glass of water. There is also a 2-minute check you can run tomorrow morning, before your feet even hit the floor, that has told me more about a patient's real risk than almost anything else I do. I will give it to you, but it only works once you understand those 4 jobs. So let's start there. And this is really the heart of everything I do now. After all these years, what I care about most is helping people stay strong and independent well into their 70s, their 80s, and beyond, instead of slowly surrendering their health to something they never saw coming. So I took everything I tell my own patients and put it into one simple plan. How to eat, the daily habits that actually protect you, the warning signs never to wave off, all of it in one place. It has already helped thousands of people live their best life after 60. If you'd like it, the link is right there on your screen. You don't need to write anything down or remember a thing. It's all waiting for you whenever you're ready. Now let me put a face on this, because I think about her every time this subject comes up. I'll call her Eleanor. She's a composite of patients I've cared for over the years, but every part of what happened to her is real, and I have seen it play out more times than I would like. Eleanor was 69, a retired school librarian, the sort of person who read the label on everything and never wanted to trouble anyone. For about 2 years, she woke up every morning with her mouth bone dry. She kept a glass of water by the bed, took a sip, and got on with her day. She mentioned it once, in passing, at a routine appointment. She was told it was probably just age, maybe drink a little more water. So that is exactly what she did, for 2 years. And the whole time, quietly, her body was working its way through the list I'm about to give you. Nobody had explained the basic thing to Eleanor, the thing I want to make sure you never learn the hard way. Saliva is a far bigger deal than it sounds. Researchers have identified more than 1,000 different proteins in it, a mix of enzymes and natural germ fighters working in your mouth every minute of the day and night. It is one of the most quietly important fluids your body makes, and it has 4 jobs. Let me take them one at a time, because each one, when it fails, is its own kind of danger, and the first one is the reason I felt I had to make this video at all. The first job of saliva is to guard your airway while you sleep. Something happens every single night that most people have no idea about. A small amount of the fluid in your mouth slips down the back of your throat and into your airway while you sleep. It is called microaspiration, and it is completely normal. In a study published all the way back in 1978, in the American Journal of Medicine, researchers found that roughly 45% of perfectly healthy adults did exactly this during deep sleep. Almost half of us. And for a healthy person, it causes no harm at all, and I'll tell you exactly why. In a healthy mouth, saliva is working around the clock to keep the bacteria down. It is loaded with natural germ fighters, things with names like immunoglobulin A, lysozyme, and lactoferrin, and their whole purpose is to hold the bacteria in your mouth to a safe level. So the tiny bit of fluid you breathe in at night is nearly clean. Your lungs handle it without a problem, and you never even know what happened. Now let the mouth go dry. Take that saliva away, night after night, and the germ fighters go with it. The bacteria that were being held in check are suddenly free to multiply, and so the little sip of fluid that slides into your lungs at 3 a.m. is no longer nearly clean. It is loaded. You are breathing a heavier and heavier dose of bacteria into your lungs, quietly, every night, while you sleep peacefully with no idea it is happening. In an older adult, whose cough reflex and whose ability to clear the lungs are already a step slower than they used to be, that is one of the ways a serious chest infection takes hold. Poor mouth health and a heavy load of mouth bacteria are a well-recognized risk factor for pneumonia in older people. That is simply the plumbing of it. This was Eleanor's first door. Looking back, she had had 2 chest infections in 18 months. Each time, a doctor gave her antibiotics and sent her home. Each time, nobody asked the question that should have been asked, which was simply, why does this keep happening to her? Nobody connected a wet cough in the winter to a dry mouth in the morning, but they are the same story. So what do you actually do about this one? You protect the mouth overnight, and I will give you the full routine at the end, but the heart of it is simple. You do not go to bed with a bone-dry mouth if you can help it. A little moisture in the room, the right kind of rinse before bed, and keeping the bacteria down with good, gentle oral care all lower the dose you breathe in. Hold on to that because it matters more than almost anything else on the list. The second job of saliva is to help you actually get fed, and this is the one that catches people off guard. We think of digestion as something that happens down in the stomach, but it starts in the mouth, the moment you begin to chew. Saliva carries an enzyme called amylase, and amylase begins breaking down the starches in your food before you have even swallowed. Saliva is also what lets you taste your food, what softens it and binds it into something you can swallow comfortably, what makes eating the easy pleasure it is supposed to be. Take the saliva away, and eating slowly stops being a pleasure. Dry food scratches going down. Swallowing takes effort. Food loses its flavor, and people respond to that without ever deciding to. They eat less. They start avoiding the drier foods, the meats, the whole grains, the raw vegetables, the very foods that carry the most nutrition, and they drift towards soft, easy, processed things that slide down without a fight. Those things are usually the emptiest, so the plate still gets cleared, more or less, but the body behind it is being fed less and less of what it truly needs. I want to say this part very plainly because it catches nearly every patient I tell it to off guard. You can sit down to 3 meals a day and still be slowly starved of nutrition. And the numbers bear it out. In a review of the research published in 2023 in the journal Nutrients, older adults with dry mouth were about 11% more likely to lose a significant amount of body weight without trying. Other research has found that people with dry mouth take in measurably less water, less folate, less vitamin E, and less of the healthy fats their heart and brain depend on. And a large review published in 2025 found that most older adults with dry mouth were either malnourished or right on the edge of it. This is happening to a great many people, and almost none of them know a dry mouth is the reason. Eleanor lost weight, a pound here, a couple of pounds there, until her daughter noticed her clothes were hanging off her and asked what was wrong. Eleanor didn't have an answer. She was eating. She thought she was fine. That was her second door, standing wide open, and nobody had even walked past it. The fix here starts before you change a single thing about what you eat. If food has gone dry and hard to manage, you moisten it. You lean on the saliva substitutes I'll describe in a moment, especially before a meal, and you protect your appetite by keeping the mouth comfortable. And you fight to keep the good foods on the plate, softened if you have to, rather than trading them away for the empty, easy ones. The third job of saliva is to keep the peace among the bacteria living in your mouth. And when that peaks down, the trouble does not stay in your mouth. Your mouth is home to an estimated 700 different species of bacteria. That is completely normal for every one of us, and most of them are harmless. Saliva is what keeps them in balance, constantly holding the harmful ones down so the whole mix stays calm. When the saliva dries up, that control is gone, and the species that do real damage, the ones behind gum disease and tooth decay, with tongue-twisting names like Streptococcus mutans and Porphyromonas gingivalis, are exactly the ones that surge. Research on older adults with dry mouth has documented that shift directly, and this reaches far beyond your mouth. Your gums are packed with tiny blood vessels. When they are inflamed and bleeding, which is what happens as these bacteria take over, something as ordinary as brushing or chewing can push those bacteria out of your mouth and into your bloodstream. Once they are in the blood, they travel. This is well established, not fringe science. Mouth bacteria in the bloodstream can settle on a heart valve and cause a dangerous infection called endocarditis, which is exactly why your dentist asks about your heart before certain procedures. There is a two-way street between gum disease and diabetes, each one making the other harder to control, confirmed in a large review published in Scientific Reports in 2021. And there is newer, genuinely striking work published in Science Advances in 2019 that found one of these gum disease bacteria in the brains of people who had died with Alzheimer's disease. I want to be careful and honest with you there, because that last one is early science and it does not prove cause and effect. But it is one more reason that what lives in your mouth is not something to shrug off as we age. Eleanor never reached this third door, thank goodness, and part of the reason is that somebody finally stopped and looked at the whole picture. But I have cared for patients who did walk through it, and it is a hard thing to watch because every step of it was preventable. Let me pause for just 1 second and then straight back to it. If this is the kind of plain, honest explanation you wish you had more time to get in the exam room, do me a small favor and tap the subscribe button and give the video a like while you're there. It genuinely helps this reach more people who need it before the day they need it. And leave me a comment. Tell me how long you have been waking up with a dry mouth, because I read these and they shape what I cover next. All right. The fourth job of saliva is to protect your teeth, and this one moves faster than almost anyone expects. All day and all night, saliva bathes your teeth in minerals and neutralizes the acids that wear enamel down. It is a constant, gentle repair service. Pull it away, and that repair service shuts off. This is why dry mouth can bring on a wave of aggressive tooth decay in someone who has brushed faithfully their entire life, and even in someone who wears dentures, which I will come back to because it surprises people. Dentists sometimes watch a mouth deteriorate over a matter of months and know, before they ask a single question, that they are looking at a dry mouth. The teeth are often the first place the whole problem becomes visible, and by then the other 3 doors have usually been open a long while. The protection here is straightforward, and I will fold it into the plan. Keep the mouth moist, use the right rinse, lean on fluoride, and do not skip the dental visits, because your dentist may catch this before your doctor does. So those are the 4 jobs, and the 4 doors that swing open when saliva fails. Which leaves the question that actually changes your life. Why did your saliva quit in the first place? Because that is the part you can do something about. And for the great majority of people over 60, the answer is sitting in a cabinet in the kitchen or the bathroom. It is your medications. This is the most common cause of dry mouth there is, by a wide margin. According to the Cleveland Clinic, more than 500 different medications list dry mouth as a side effect. 500. And they are not obscure ones. They are among the most commonly prescribed drugs in this country. Blood pressure pills, antidepressants, antihistamines for allergies, water pills, bladder control medications, and sleep aids. If you are over 60, there is a very good chance you take at least one of these, and a lot of people take several. These medications have one property almost nobody explains. Their effect stacks, and it stacks faster than you would expect. A certain group of them, a class doctors call anticholinergics, are especially good at switching off saliva, and 2 of them together can dry you out more than twice as much as one on its own. In a study published in 2024, older adults taking these kinds of medications were far more likely to have genuinely low saliva flow than those taking none, and the more of them a person was on, the worse it got. Doctors have a phrase for this total load. They call it your combined anticholinergic burden, and I want you to remember those exact words, because I am going to have you use them. There is also a threshold worth knowing. Once you are taking 5 or more medications of any kind, something we call polypharmacy, your risk of side effects like this climbs sharply, and it becomes genuinely hard for any one doctor to keep track of how they all interact. This was Eleanor's real answer. When someone finally sat down and went through her list, she had been on several medications for years, 3 of which, on their own, were mild. Together, they had been drying her mouth out for 2 solid years, and not one person had ever looked at the combination. But medications are not the only reason saliva quits, and this is where you get to play detective, because the exact flavor of your dry mouth often tells you which other door to check. So let me hand you the readout. This is how you read your own dry mouth. If your dry mouth is worst first thing in the morning and settles down through the day, that points toward mouth breathing at night and often towards sleep apnea, where the airway keeps collapsing during sleep. In one study, about 45% of people with sleep apnea woke up with a dry mouth, compared with about 20% of people without it. If that sounds like you, especially with snoring or daytime exhaustion, ask about a sleep study. If it comes with getting up over and over in the night to urinate, that pairing is one of the classic early signs of high blood sugar. The extra sugar pulls water out of your tissues, which dries your mouth and keeps filling your bladder. Ask your doctor for a simple blood sugar test, the one called an A1C. Pair a dry mouth with dry, gritty eyes, the feeling of sand in them, and you are looking at the fingerprint of an autoimmune condition called Sjogren's syndrome, where the immune system attacks the very glands that make your tears and your saliva. It is far more common in women. About 9 out of 10 people who have it are women, and it usually surfaces in your 50s and 60s. It is very treatable, but it has to be named first. A metallic taste, or breath that starts to smell faintly of ammonia, is a more serious pairing, and it can be a sign the kidneys are struggling to clear waste the way they should. Don't panic over it, but do get your kidney function checked. And a dry mouth alongside leg or foot cramps can point to your electrolytes being out of balance, the sodium, potassium, and magnesium your body runs on. That one matters a great deal because a bad enough imbalance can affect your heart rhythm, and it is more likely if you take water pills. Get your levels checked. You see what is happening here. Your dry mouth is information. It is one of the very few warning signs your body hands you that you can actually read yourself at home for free before a single test is ever run. Now let me answer the 3 things I know some of you are thinking because I hear them in my office all the time. The first, some of you are thinking, my doctor said it's just aging. With respect to your doctor, that is almost never the real answer. Truly age-related dry mouth, all on its own, is far less common than people assume. Persistent dry mouth is nearly always caused by a medication, a medical condition, or both. And the reason it gets waved off is not a bad doctor. It is a 12-minute appointment and the fact that there is no neat box to tick, no quick billing code for the 10 quiet minutes it would take to sit and untangle your medication list. So it becomes just aging, which is really a way of ending the conversation rather than a diagnosis. You are allowed to reopen it, and now you have the words to do exactly that. The second, the idea that you can just drink more water. I wish it worked that way. Dry mouth is a problem with the glands that make saliva, not with how much water is in your body. So water buys you a few seconds of relief and then it is gone. And there is a reason it can never truly stand in for saliva. Saliva is about 99% water, but it is that last 1%, the proteins and minerals, that actually coats and protects your mouth. Water rinses straight through. Saliva clings and defends. So please, keep drinking your water. Staying hydrated still matters, especially if you take water pills. Just know the water is not the cure, and stop feeling like you are failing. It doesn't fix things. The third, and people are often shy to raise it. What about dentures once the natural teeth are gone? It absolutely still applies, and in some ways it becomes even more important. Without saliva to keep them in check, bacteria build up against the gum underneath a denture, and the tissue there takes a real beating. You do not need your own teeth to suffer the consequences of a dry mouth. If anything, you have to guard against it all the more carefully. So let me bring you back to Eleanor, because her story does not end with a glass of water on the nightstand. What finally turned it around was almost embarrassingly simple. At one appointment, her daughter came along, and she asked the question Eleanor had never thought she was allowed to ask. She said, "Could all of this, the dry mouth, the weight loss, the chest infections, could it be her medications working against each other?" And that one question changed everything. Someone did a proper review of her list at last. 2 of her medications were switched to gentler alternatives that did the same job without drying her out. One, it turned out, she no longer needed at all, and it was stopped. I want to be honest with you about what came next, because I am not going to sell you a miracle. It was not overnight. But within a few weeks, Eleanor's mouth was no longer bone dry in the mornings. Within a few months, she had put back most of the weight she had lost, and her appetite came back with it. And she got through that next winter without a single chest infection for the first time in years. Nothing exotic saved Eleanor. What saved her was simple. Somebody finally read the message her body had been sending every morning for 2 years and treated the cause. That is the whole point of this. The message was there the entire time. It just needed someone to listen. So let me leave you with exactly what to do, starting tomorrow morning. None of it is complicated, and most of it is free. First, the 2-minute check I promised you, and I want you to actually do this one, because it has told me more than almost any test. Tomorrow, before you get out of bed, before you reach for that glass of water, just notice. Is there any saliva in your mouth at all? Is what's there thin and watery, or thick and stringy? Is there any strange taste or smell? Can you swallow without needing a sip of water first? Do that for a few mornings and write down what you find, because that is real information your doctor can use, and it takes the guesswork out of the conversation. Second, do a medication audit. Write down everything you take, prescription and over-the-counter, every last one. Then bring it to your doctor or your pharmacist and say these exact words. I would like a review of my combined anticholinergic, and if you take 5 or more medications, ask specifically whether any of them could be adjusted. Those words tell them you know what you are talking about, and they change the whole conversation. Do not ever stop a medication on your own. This is a conversation, not a decision you make alone in the kitchen. Third, protect your mouth day and night. Keep sipping water, but add the things that actually work. Chew sugar-free gum sweetened with xylitol, or let a sugar-free lozenge dissolve slowly to coax the glands back to work. Use an alcohol-free rinse made for dry mouth, and skip the ordinary mouthwashes with alcohol in them, because alcohol only dries you out further. Keep crunchy, water-rich foods like carrots and cucumber on your plate, because chewing itself brings saliva up. There are also over-the-counter saliva substitutes, sprays, and gels that can genuinely help, especially before meals and at bedtime. And run a cool mist humidifier in your bedroom, kept somewhere between 30 and 50%, so you are not breathing dry air all night long. Fourth, read the signal and take it to the right place. Worst in the morning, look into sleep apnea. Waking to urinate, get your blood sugar checked. Gritty, dry eyes, ask about Sjogren's. A metallic taste, get your kidneys checked. Leg cramps, get your electrolytes checked. And if the dryness is severe and none of this is enough, there are prescription medicines that can switch the glands back on. Your doctor decides whether they are right for you. And know the true emergencies, because they are rare, but they matter. Dry mouth with real trouble breathing is an emergency room right now. White patches inside the mouth that don't wipe away can be a yeast infection, so see your doctor promptly. Dry mouth with sudden confusion, weakness, chest pain, or a racing heart, that is a call to 911. Those are the lines that mean stop what you are doing and pick up the phone. That is the whole picture. The dry mouth you have been brushing aside every morning is one of the most honest signals your body has, and now you know how to read it. If this helped you understand something nobody had taken the time to explain, take a second to subscribe, tap like, and leave a comment, because it truly helps me get this to more people who need it. Look after yourself, pay attention to what your body is quietly telling you, and I'll see you in the next one. I'm Dr. John Myers. Take good care.